considered or actually put into use to set off the high cost of health care in the United States. Additionally, you will have a better idea of how you can save on health care. The rising cost of health care can, in great part, be attributed to obesity and obesity-related medical conditions. According to the Office of the Surgeon General, 1 in 8 deaths can directly be attributed to obesity and other diagnoses that are related to obesity. And it's no surprise because 2 out of 3 Americans who are obese are considered overweight. According to the Society of Actuaries, since 2001, employer-sponsored health coverage for family premiums has increased by 113%, placing increased burdens on employers and workers, and these costs are due to lost worker productivity, increased cost of medical care, and worker disability. According to the Centers for Disease Control, healthcare spending went up by $40 billion. In 1998, from 18.3% in 1998, it increased to 25% in 2006. The Congressional Budget Office predicts that per person obesity-related spending will increase an average of 3.6% a year, which is an astronomical number. Legislators in over 25 states are working on more than 140 bills that are aimed at combating obesity. Obesity, overweight, fat, no question, it's one of the nation's worst and most costly of health problems, primarily because it attributes to other disease processes such as heart disease, diabetes, kidney failure, so it's all related. Over 44 million Americans are now considered obese. Doctors attribute the obesity to 3 things, which is poor quality food, fast food, lack of exercise, and also too much time in front of a screen, whether it's a television or a video game, but there's too much screen time. David B. Allison, the director of the University of Alabama, Birmingham, he's the clinical nutrition research at the Clinical Nutrition Research Center, cites additional reasons for obesity, one of which could be sleep deprivation. Americans get less sleep now than ever before. Pollution affects your hormones, which can increase the weight gain. The fact that Americans stay in temperature-regulated surroundings where our bodies aren't required to burn calories in order to regulate our temperatures. Some medications can cause weight gain. If 2 obese people marry and procreate, their children are they're genetically predisposed to obesity. So what are 2 ways that are currently being used or being considered to combat the rising cost of health care? Well, one is insurance by the pound, which is your health insurance premiums. Health insurance is based on, they derive your premiums taking many factors into consideration. And primarily they're looking at the health of the individual in question. So in obesity, they measure with your BMI, your body mass index, and individuals with a BMI of 39 or greater generally can't even get insurance because they're obese and they're predisposed to other disease processes, which in turn are going to increase their costs for health care. So with a BMI of over 39, you're going to be considered high risk. Another way of combating the healthcare cost of healthcare is the fat tax, and the fat tax originated in Denmark, where the Danes they put a tax on the high-fat foods, and it was they taxed it per kilo, but for the fat that was put into the food as it was being produced. So Denmark has their level of obesity is 14% as compared to the American level of obesity, which is over 33%. So the fat tax is working, and the money they derive from taxing the fat, they can put into different programs. They can also put it into growing and producing better quality foods. Eric Topol, a cardiologist, the chief cardiologist at Cleveland Clinic, has suggested that the nation consider a tax credit. So for individuals that are fit and slim, they should be given a tax credit, where others that are really having to use the healthcare system and taxing the healthcare system, they should be paying a standard tax. That people with a lower BMI would get a tax rebate. New York State Assemblyman Feliz Ortiz has proposed legislation that would put hefty taxes on snack and fatty foods, and then also he encourages taxing sedentary activities such as going to the movies, DVD rentals, and his proposal, in his estimation, that they would gain $50 million a year from these taxes, which they could put into programs that would be more healthful for their state. My proposed solution: I think that individuals that maintain a healthy lifestyle and maintain a low BMI should be extended a federal and state tax credit. I think that employers that should encourage more healthful living, subsidize gym memberships or activities that encourage healthful living. I think individuals that require larger seats in airplanes, in the movie theaters, they should incur a surcharge, something that would maybe perhaps be an impetus for them to make an effort and lose some weight. So anyhow, the cost of healthcare is skyrocketing in our country. Obesity-related diseases and problems are taking up most of our expenditures, and these costs need to be controlled. I've discussed two approaches: the healthcare by the pound and then the fat tax. And plus, I've put my proposed ideas out there for you. Individuals need to be accountable for themselves, and they need to take responsibility for themselves. So food for thought. Think about it.